Here is the part of moving abroad that rarely makes it into the best cafes in Lisbon or how to rent in Athens videos. You are not just changing countries, you are changing ecosystems. In Southern Europe, the surprise is not that nature is dangerous in a cinematic way. It is that the risks are ordinary, seasonal, local, and easy to misread if you arrive with the wrong mental map. The Mediterranean can feel gentle right up until your dog picks up sandfly exposure, your village has a West Nile alert, or you learn that the mosquito in your new backyard did not care that you came for work-life balance. The big thesis is simple. Southern Europe is usually a prevention problem, not a panic problem. Ticks, mosquitoes, sandflies, jellyfish, and the occasional venomous snake are real, but the actual expat risk is driven less by drama and more by habits, housing, pets, seasonality, and how fast you can navigate local healthcare. Italy and Greece had serious West Nile activity in 2025. Portugal's vector footprint kept expanding, with Aedes aegypti established in Madeira and Aedes albopictus spreading further on the mainland. Albania's public data are thinner, which may be the most important warning sign of all, because thin data can mean thin awareness. Your new biome. Southern Europe is not low risk. It is risk-shaped differently. ECDC maps show established tick distributions across European regions, and Mediterranean countries also sit inside the main European zone for phlebotomine sandflies, the vectors of leishmaniasis and Toscana virus. Sandflies in Europe are mostly active from April to November, feed mainly at dusk and night, and can live not only in rural landscapes but also in peri-urban and urban settings, especially where there are cool, humid resting places, cracks in buildings, animal shelters, and nearby dogs or other hosts. In other words, your charming stone house can double as insect real estate. Mosquito risk is also changing. WHO Europe notes that mosquito-borne diseases in the region include dengue, West Nile, chikungunya, Zika, and malaria, while ECDC's guidance links locally acquired Aedes-borne outbreaks in Europe to the spread of invasive mosquitoes like Aedes albopictus and Aedes aegypti. Portugal's national vector surveillance shows exactly what that shift looks like in practice. Aedes aegypti has been present in Madeira since 2005, and Aedes albopictus expanded to 28 Portuguese municipalities in 2025. Then there are the non-vector hazards that expats still need on their radar. Portugal's IPMA says Portuguese man-o'-war occur frequently along the Portuguese coast, including Madeira and the Azores, and have the harshest sting among local gelatinous species. Across Mediterranean Europe more broadly, jellyfish are a recurring summer coastal nuisance, especially in warmer months. Venomous snakes are present in southern Europe as medically significant vipers, but for most expats, they are a hiking, gardening, and rural property problem, not a daily urban problem. Leeches exist, but in southern Europe, they're usually a niche wilderness annoyance. In tropical Asia, they become much more of a real trekking issue. Southern Europe, up close. Italy is probably the clearest example of why Southern Europe is too broad a label. The country has widespread Aedes exposure, major West Nile activity in some years, localized TBE risk, relevant Lyme areas, sandflies, and medically significant vipers. ISS reports show that in 2025, Italy recorded 773 confirmed human West Nile virus infections by late October, including 367 neuroinvasive cases, with heavy burden in regions such as Lazio, Campania, Lombardy, Veneto, and Emilia-Romagna. Italy also saw autochthonous dengue and chikungunya transmission in 2025, with local dengue events in Emilia-Romagna and Veneto, and large chikungunya activity across Emilia-Romagna, Veneto, Tuscany, and Basilicata. Lyme has historically been concentrated in Friuli, Venezia Giulia, Liguria, Veneto, Emilia-Romagna, and Trentino Alto Adige, while TBE risk is centered in the northeast. Belluno was the first recognized Italian TBE province, and vaccination has been available in Italy since 2006. Greece is the country that reminds you that urban does not mean safe from nature. The Hellenic National Public Health Organization reported 96 locally acquired West Nile cases in 2025, including 76 neuroinvasive cases and 9 deaths, with symptom onset from late June through late September. Exposure municipalities included not only rural Thessaly and Evros, but also multiple parts of Attica, Piraeus, and Athens adjacent areas. Greece is also inside the Balkan and Eastern Mediterranean sandfly zone, so leishmaniasis ecology matters, especially where dogs, warm nights, and peri-domestic environments overlap. Public data on Lyme and TBE are thinner and less prominent than Greece's mosquito surveillance, which is itself a useful signal. For most expats in Greece, the most visible and actionable vector risk is mosquitoes first, ticks second, sandflies third. Portugal often looks like the calmer case, but the trend line matters more than the stereotype. INSA's 2025 review report shows Aedes aegypti still established in Madeira, Aedes albopictus expanding further on the mainland, and DINV2 detected in Aedes aegypti samples from Madeira. The same Portuguese surveillance system found Borrelia DNA in 2.3% of tested ticks in 2025 and detected Toscana virus in sandflies in central and northern mainland municipalities. ECDC's 2025 dengue surveillance recorded 2 Portugal cases in Madeira, probably linked to transmission in late 2024, which is exactly how these risks work in real life. The human numbers may be small, but the ecological conditions are there. And on the coast, Portugal's jellyfish monitoring program is blunt. Portuguese man-o'-war are frequent, highly stinging, and worth taking seriously. Albania is where the main issue is not only exposure, but also data scarcity. Albania's own public health literature shows Lyme cases have been documented for decades, with 11 ELISA-positive cases identified in suspected patients during 2011 to 2015, and tick distribution reported across districts including Tirana, Berat, Elbasan, Korç, Gjirokastër, and Saranda. In 2025, official blood safety alerts flagged confirmed human West Nile virus infections in Berat and Elbasan. Albania clearly has the ecological ingredients for tick and mosquito exposure, and peer-reviewed summaries describe venomous vipers as established in the country as well. But surveillance is patchier, and the Albanian Lyme paper explicitly notes that reporting is not mandatory, and that no national surveillance system was in place for Lyme at the time. For an expat, that means less certainty, not less risk. Across the wider Mediterranean arc, the pattern repeats with local accents. ECDC describes sandfly-borne disease as widespread and underreported in many countries of southern Europe, and its 2025 surveillance also recorded Crimean Congo hemorrhagic fever in Greece and Spain. So if you are choosing between southern Italy, the Albanian Riviera, a Greek island, inland Portugal, or the wider Balkan coast, the smart default is this. Assume the rules rhyme, then learn the local disease calendar matters. If you want one calendar rule, it is this. Late spring to early autumn is when nature starts sending emails. Tick risk for Lyme rises with outdoor exposure in warmer months, and early Lyme is still a clinical diagnosis first, not a lab result contest. CDC guidance is useful here even in a European setting. Early tick-borne illness can be missed on early testing, and clinicians should not wait for perfect labs before treating a strongly suspected acute infection. In Italy, Lyme is concentrated in the north and northeast, while TBE remains a more localized problem, especially in northeastern endemic areas, which is exactly why the vaccine conversation matters there and much less in most of southern Portugal or coastal Albania. West Nile follows the mosquito season and punishes complacency. Greece's 2025 season ran roughly from late June to late September for symptom onset, and Italy's 2025 season grew into a major outbreak. These are not purely countryside diseases. They can show up in peri-urban and urban environments because the ecology depends on mosquitoes, birds, heat, and water management, not on whether your address feels rustic. In Greece, NPHO notes that West Nile has been established for years and that affected and high-risk areas trigger blood safety measures. That is the bureaucratic version of nature changing the rules. Dengue and chikungunya are the diseases that make southern Europe feel a little more like the tropics than many expats expect. ECDC's 2025 surveillance documented locally acquired dengue in France, Italy, and Portugal, while Italy's ISS also documented substantial local chikungunya transmission. The actual human incidence is still far below tropical Asia or parts of the Americas, but the important shift is ecological feasibility. Enough invasive Aedes mosquitoes are now established that imported infections can spark local summer and early autumn clusters. Malaria, by contrast, is not the defining day-to-day expat risk in southern Europe. It becomes relevant mostly in comparison with Asia and the Amazon, where it remains a much bigger operational reality. Healthcare changes risk. Healthcare access is part of your exposure profile. In Italy, 112 is the main emergency number, and the national health system provides medically necessary public or accredited care with EHIC coverage, except for applicable regional tickets. Ambulance service is normally free with EHIC. Out-of-hours primary care exists through Guardia Medica, and public emergency departments may charge low-priority copays for inappropriate non-urgent use. 1. Rome-based explanation for Lazio cites around €25 for some white coat use. The catch for expats is navigation. Residents need local registration and a family doctor for smoother public access, while uninsured or convenience-driven newcomers often default to private English-speaking clinics, where a general medicine visit can start around €150 and specialist visits around €180. In Greece, access depends heavily on whether you are properly in the system. Residents who register and contribute can access EOPY-backed care on the same basis as Greek citizens, and public hospital treatment is free with referral. But the pricing details matter. The European Commission's EHI page for Greece says an ESY outpatient consultation without your EHI can cost €20. Prescriptions usually carry around a 25% contribution, and diagnostic tests and contracted private providers usually involve a 15% patient contribution. Emergency ambulance transport is available via 112 or 166 and is provided free by EKV in the public system. Translated into expat terms, being kind of sorted is not sorted. Have NKK, insurance, and documents ready before mosquito season, not after. In Portugal, legally resident migrants who are registered with the SNS and Social Security can use the public system through local health centers and hospitals, with 112 and the Saúde 24 line as the key gateways. The private side is more transparent on pricing than in many countries. A major Portuguese private network lists general medical consultations around €100, specialty consultations around €140, and general urgent care around €78, with inpatient day rates much higher. That means Southern Europe can still be relatively manageable for uninsured outpatient care compared with the US, but the cost jump from "I need a doctor today" to "I need observation, imaging, and a hospital bed" is real. In Albania, the official system is three-tiered. Emergency hospitals are available in major centers, and ambulance is 127. But for expats, the operational reality is that public information on tariffs and coverage is much thinner than in the EU countries above. EURAXIS describes a public system with primary, secondary, and tertiary levels, while UK travel guidance emphasizes use of insurers and access to translators and interpreters if needed. In practice, that usually means people with means gravitate toward private hospitals in Tirana, especially when they want speed, imaging, or English-speaking staff. So for Albania, the most honest line is this: insurance matters more because transparency is worse. Language is the hidden multiplier across all four countries. English-speaking care exists, but it is easier to find in capitals, tourist regions, and private clinics than in smaller public facilities. Greece's official travel guidance points people toward provider lists with some English-speaking staff. Albania's guidance includes translator support routes, and Italy's expat-facing private clinics openly market English-language care and direct billing to international insurers. That is why your insurance should cover outpatient visits, diagnostics, emergency transport, hospitalization, and repatriation, not just the dramatic stuff. The boring invoice often arrives before the dramatic rescue helicopter. Prevention without panic. The prevention toolkit is not glamorous, but it works. EPA lists DEET, Picaridin, PMD, IR 3535, and related ingredients among skin-applied repellents, and its safety guidance is very unromantic in the best way. Follow the label, apply only to exposed skin and clothing, do not use underclothing, and be careful around eyes and mouth. When vector risk is real, repellents are less of a travel accessory and more of a basic utility, like charging your phone. For tick bites, the rule is speed and simplicity. CDC guidance says to remove an attached tick promptly with fine-tipped tweezers, pull upward with steady pressure, do not twist, clean the site, and watch for rash or fever in the following weeks. If symptoms appear, tell the clinician when the bite happened and where you were likely exposed. Clinicians are also advised not to wait for laboratory confirmation when acute tick-borne disease is strongly suspected, because early tests can be insensitive. That matters if you move to wooded or farm-heavy parts of Italy, inland Portugal, or rural Albania and start treating weekend hikes like casual houseplants. For TBE, the question is not, does the vaccine exist? It does. The better question is, does my exposure justify it? Italy's ISS says the vaccine has been available there since 2006, and CDC recommends it for people moving to or traveling in endemic areas who will have extensive tick exposure through their itinerary or outdoor activities. So if your dream move is a remote work life plus mountain biking, mushroom foraging, forestry, or frequent rural trails in northeastern Italy, have that conversation before summer. And if you have a dog in sandfly country, ECDC specifically notes the use of deltamethrin-impregnated collars to reduce canine leishmaniasis risk. Pets change your risk map because they are not reading your prevention checklist either. For jellyfish and Portuguese man-o'-war, the first aid advice is delightfully specific. Portugal's IPMA says to rinse with seawater, not fresh water, remove tentacles with tweezers, avoid rubbing, and note that Portuguese man-o'-war is handled differently from standard jellyfish. Vinegar or hot packs can be appropriate for Physalia, while common jellyfish stings are managed with ice packs after seawater rinsing. If you are shocked, short of breath, or the pain persists, seek care. For suspected venomous snakebite, skip the folklore and go straight to medical care. WHO still treats snakebite and venoming as a significant tropical and subtropical public health problem globally. In Southern Europe, the incidence is lower, but the "don't be a hero" rule still applies. Asia changes everything. The comparison with Asia is where Southern Europe starts to look almost reasonable. WHO notes that dengue is endemic in 10 of 11 countries in the Southeast Asia region, with countries such as India, Indonesia, Myanmar, Sri Lanka, and Thailand among the world's most highly endemic. WHO also estimates that Asia sees up to 2 million snake envenomings annually. Add the practical reality that wilderness medicine literature describes leech exposure as common in the outdoors, and you get the contrast. In Southern Europe, nature mostly asks for seasonal discipline. In South and Southeast Asia, it can demand a fully different operating system. In the Americas, the difference depends on where you land. PAHO reported more than 537,000 malaria cases in the Americas in 2024, with increased transmission in Bolivia, Peru, Colombia, Haiti, and Panama, and it is still investing specifically in Amazon border region malaria control. That is a completely different category of risk from a Mediterranean beach town. Meanwhile, in the United States, West Nile is the leading mosquito-borne disease in the contiguous country. Lyme is concentrated in the Northeast, Mid-Atlantic, Upper Midwest, and parts of the Pacific Coast, and CDC reported unusually high tick bite emergency visits in 2026. So even the Americas split in two stories: tropical forest and border river medicine in one direction, suburban tick and mosquito management in the other. That is the real comparison point for expats. Southern Europe is not safe nature, and Asia or the Americas are not danger nature. The better division is this: some places are dominated by localized seasonal vector management, while others are shaped by year-round endemic transmission, higher snakebite burden, rainforest ecology, or much larger mosquito disease loads. If you understand that difference before you move, you stop making lifestyle choices based purely on aesthetics and start making them based on exposure, which, to be honest, is a lot more useful than choosing a country because the pastries looked emotionally supportive. Checklist and visuals. If I were moving tomorrow, my shortlist would be painfully practical. Check whether your target area has recent West Nile, dengue, or chikungunya alerts, not just whether the country had them in the past. Greece and Italy publish regular surveillance updates, and Portugal's vector updates matter even when human case counts are small. Learn the local emergency path immediately. Italy 112, Greece 112, or 166. Portugal 112 plus Saúde 24. Albania 127 for ambulance. Albania 127 for ambulance. Save them before you need them. Register into the public system as soon as you qualify. ASL SSN in Italy, EOPY and ANCA in Greece, SNS in Portugal. I'll sort it later. Is how small problems become expensive private problems. Carry a repellent you will actually use, ideally with DEET, Picaridin, or PMD, and follow the label. Fancy natural optimism is not a control strategy. Keep a tick kit at home and in the car. Tweezers, antiseptic, and a note in your phone for date and place of exposure. That information helps the clinician far more than your beautifully vague memory. If you are choosing between urban and rural housing, treat ground floor gardens, stone walls, kennels, animal shelters, and stagnant water as exposure variables, not rustic charm alone. If you have a dog, ask a local vet about tick prevention and sandfly protection, especially in Mediterranean leishmaniasis zones. Deltamethrin collars are part of the public health answer, not just a pet store upsell. If you will spend serious time outdoors in northeastern Italy or another TB endemic area, ask about the TBE vaccine before the season begins. Buy insurance that covers outpatient visits, diagnostics, emergency care, hospital admission, and repatriation, because the real cost spike usually comes after the first consultation. For visuals, the strongest package would be a Southern Europe vector map based on ECDC tick and sandfly distributions, a 2025 West Nile comparison chart for Italy and Greece, a Portugal inset showing Madeira versus mainland 80s dynamics, and one clean risk matrix contrasting urban apartment, coastal town, rural stonehouse, and mountain village. A final graphic should show the simple truth that changes behavior fastest. Country risk is weaker than local ecology plus routine. The big data limitation is that cross-country comparisons are messy. Surveillance definitions, diagnostic access, and reporting systems differ, and ECDC has explicitly noted that TBE comparisons are affected by differences in definitions and laboratory capacity. Southern European leishmaniasis is also considered underreported, and Albania's own Lyme literature states that national surveillance has been incomplete. So treat the country-level numbers as guidance, not as a guarantee that your municipality is quiet. Nature is local, and public data often lag behind the mosquito. Moving abroad is not just changing your address, it is learning the rules of a new living system before that system introduces itself the hard way.